Today's date is January 28th, 2014. We're here with Melanie. I videoed Melanie before about her shoulder. She had a miracle here, but now she's got a crisis. Melanie, please summarize as quickly as you can what's happened to you and your pain.
I was injured at work. I was injured twice, and because my employer has a history of punishing injured workers, I delayed getting help. I also have strong beliefs about not taking drugs and avoiding surgeries if they're not necessary. I tried to do everything that was asked of me to get through this workers' comp case so that I could heal 100%. They have decided that I only have a 2% disability, which I do not accept. This has affected my whole life. I can't walk my dogs. I can't care for myself. I cannot care for my mom. I cannot eat. I began having jaw pain and face pain in physical therapy. My dentist even ordered MRIs that my orthopedic surgeon refused to look at or explain to me what they meant. I don't understand why I'm in pain or why nobody will help me. The last doctor that I saw put me in so much worse pain that I want to kill myself.
Now, you told me that you have pain in your jaw, both sides, correct?
Yes.
You've told me that there's certain physical movements that seem to trigger this.
Yes.
You've also told me that when your dentist, we'll leave his name out for right now, has injected a couple areas, it goes away, but temporarily.
Yes, correct.
And then it comes back within a couple weeks. You've
Yes.
been tried on drugs.
Yes.
They didn't work, right?
No.
You had a couple surgeries on
Yes.
your jaw. That
Yes.
didn't work either, correct?
Well, supposedly the surgeries fixed the issue with the jaw, that there's no more issue. So there is no more necrosis that could be causing this.
Accepted, okay? But at work, you had some twisting motions that could have strained your shoulder, correct?
Yes, and that's all I felt. All you feel in your body is the loudest pain, and if I hurt more than just my shoulder in the first surgery, then in the first accident, then I don't know. I don't know what happened. I just know that I never had this pain before, and I don't know how to make it go away, and I don't know how to live with it anymore.
Okay, and it's there 24/7?
Yeah, pretty much.
Okay, turn your head to the right. No, not your body, just your head, please. Okay, turn to the left. Not your body, just your head. Bend your head back as far as you can, please. And now down. Most people have more flexion than extension. You have no flexion. Can you touch your ear, your right ear, to your shoulder?
No.
How about the other way?
No.
No. Okay. We're having a little bit of tenderness here, not a lot, correct?
Yes.
Okay. And most of your pain, show us where the pain is with your finger in your face.
It goes like that, and it goes up in here. I have pain up in here. And sometimes I can't eat or swallow or drink.
Okay. And you're telling me that the workers' comp won't send you to a chiropractor, is that correct?
I have been unable to get any medical treatment. I went to see a QME in August of 2013, and he ordered several things to be done, none of which was authorized. I tried even calling the pain management doctor several times. I still have been unable to get an appointment. Nobody wants to help me. The MRI that my dentist ordered cost a lot of money, and so the hospital doesn't even want to admit me as a patient. I have nowhere to go, and I've become a burden to my mother.
Have they tried labeling you as a mental case?
I feel like I am. I feel like I'm crazy because I'm in so much pain all the time. I just can't stand it.
Okay.
I don't like who I've become. I don't have any control over my emotions.
That's certainly understandable when you have pain. Very few people that have control.
But I have a very high tolerance for pain. I never did drugs or drank alcohol or smoked cigarettes even when I was a young person. I have to be in control of my body, and I'm not anymore, and I don't understand why, and I don't know why nobody will help me. I begged my workers' comp and claims administrator to help me. I told him that I could be 100% if they would just help me.
Part of the problem is conventional medicine doesn't know how to help certain types of pain problems. They can't see it. They can't measure it. They can't feel it. Okay, and that's what we try to do here, is to find out where it's coming from. Thank you, Melanie. All right, Melanie, we just did your treatment on your neck.
It's gone.
What is?
It's gone.
Melanie, can you turn your head to the right for me, please? Okay, turn it to the left, please. I'm going to get you to sit up and do that in just a moment. All the way to the left, as far as you can. All right, bend your chin down now, as far as you can. Gee, my God, you can actually pick it up. I want the viewer to know that I have you laying down right now because you had a vagal reaction. You got sweaty, lightheaded. I had to lay you down after the treatment, which is not uncommon. You understand that?
It always happens when I have my jaw numbed.
Right. Anybody can have a vagal reaction.
It's normal for me.
Okay, we put you down. Now, I want you to sit up. I want to see if you can sit up on your own, actually. Okay, and face me. Okay, now let's take a look and see what you're able to do with your head. Turn it to the right as far as you can. Not your body, just your head. Turn it to the left as far as you can. All right, good. Bend it down. Can you touch your chin to your chest? Oh my.
Almost.
Bend it back. All right, good. So now tell me what's happening subjectively, please.
The face pain is gone.
It's totally gone?
It's gone. I can't feel anything except skin. Feels like it's my face again. I can touch my face.
Okay, I want to see, when you walked in the door, I asked you to put your arms above your head, right?
Yeah.
And you couldn't do it. You needed my help. Now let me see you put your arms above your head,
I
please.
haven't shaven.
I don't care. Higher. Okay. Bring him down.
Oh, Dr. Norma, thank you so much.
What did you...
You saved her life. She's been
Well-
suffering for so long.
We don't know
I know.
the duration of this right
But I
now.
have hope now because of you.
Well, thank you. Are you surprised by what you just saw?
Yeah, because we saw a lot of doctors and nobody wanted to help. I didn't know what to do.
I did not photograph her attempting to pick her arms up because she couldn't. Is
Right,
that correct?
right.
She could not get her
No.
arms above her head.
Sometimes she would fall on the floor and I couldn't get her up. It was horrible.
She didn't have the strength to get up.
No,
Okay. What do you think about how she was able to get up off of the table this time?
I felt so good.
What would she
I
have been
felt
like?
hope.
What would she have been like getting off of that table from a prone position? Excuse me, that was a supine position. What would she have been like before we did
She
the
would have
treatment?
just cried and screamed.
Not been able to get up.
No.
Okay. Melanie, on a scale of 10, I know you walked in here with 10 points on a scale of 10. I know that because you walked in here crying. In fact, I could barely get a history from you, right? You were just bawling, and I had to calm you down just to talk to you, and we know each
I
other
don't
well.
want to be disabled. That's why. I want to be able to use my body.
Well,
And I have hope again.
you're in the right office for that.
Yes, that's why I'm
Because
here.
I like to use my body, and I'll do anything possible to help someone else be able to use their body.
And I'm too young to be disabled.
Okay. Now, you have 10 points of pain. What grade do you give me right now? Be honest.
7.
You've gone from 10 to 7?
Yeah.
So it's only a 30% improvement.
Well, I'm sore now back here from the injections, but I don't have any facial pain. So that would be 0 for the facial pain.
That's
from
what I'm
10
interested
to 0.
in. Okay, that's what I'm interested
I
in.
couldn't touch my face. I couldn't put lotion on my face. I couldn't brush my teeth. I haven't been able to touch my face in months.
Is that true?
That's very true. That's very true.
Mom can't even touch my face.
I can't even touch her face. If I go near her, she screams. I'm not kidding. If I just...
And I'm so tired of feeling like I'm insane because people are like, well, you're just upset or you're just having anxiety or you're just depressed. And so when I started feeling the facial pain after a while, I started feeling like I was losing my mind. I started burning myself because the pain was so bad. Because I can't take drugs and I didn't know what else to do. I had to make the pain go somewhere else.
So the pain in your face, which was 10 points, is now 0, correct?
There's no pain at all.
Okay.
There's no pain at all.
And
in my face.
and you have discomfort in your neck from the injections, correct?
Yes.
Is it that high though? Is it really a 7?
I think I was having neck pain when I walked in here and it was presenting itself as facial pain. And that's why I wanted a chiropractor because I don't believe in the traditional treatments for trigeminal neuralgia, and I felt that it could be corrected structurally because it came on after I injured myself structurally, and they don't believe that in traditional medicine. They just believe that neurologists and surgery.
I'm going to say one thing about me. I listen to my patients.
Yes.
Would you not agree?
Yes, that's why I'm your patient.
I listen to every word you say so that I can have a clue as what's going on, right?
Yes.
You did tell me you thought there was something structural,
Yes.
right? And what I did, I want the viewer to know that what I did was I looked for something structural the way I do it, and I found it in your neck.
And I found it in my pain diary. And that's why I keep a pain diary, because I wanted to try to figure out how to undo this, because I felt that there was a way to undo this, and I just couldn't figure it out.
Well, quite possibly, Melanie, there's an underlying cause in your neck, and through the autonomic nervous system, it's reflexing out to your head and your face and everywhere else.
And that's why after I got hurt the first time, it turned into facial pain. And the dentist couldn't manage it anymore.
Because he wasn't aware.
It wasn't really a dental thing.
It wasn't a dental problem. But the dental problem did manifest. You did have dental problems.
I did.
We know
I did. But Dr. Sen said I had very healthy gums and teeth, other than the osteonecrosis.
And I accept Dr. Sen because I think he's a fabulous dentist.
Yeah,
so
do I.
If he tells me something, I listen.
So do I. And he took x-rays in October, and he said there is no infection there.
So we got to look elsewhere. So we looked elsewhere today. We found a problem my way at C7.
That's right.
So I treated C7, which for the viewer is where that mark is on your neck, but that would be the C7 vertebrae right about here. And we treated that. You had a vagal reaction. You about fainted, which is okay. Now you have a smile on your face because your face is relatively pain-free. Now, what's interesting is, if we get rid of the horrible pain that was in your face, which seems to be gotten rid of, now maybe the source can appear. So if you do have some pain in your neck, it really wouldn't surprise me. Hopefully it's down from what it was, because you can now perceive it in your neck. If you're preoccupied so much with pain in your face, and that's your focus, and that's all you can feel, then you can't feel pain elsewhere.
That's